Hey everyone, thanks for joining us for another episode of Total Thyroid with John Russell. I am John Russell and I am your host as we talk about all things thyroid related. And today, after talking to some patients, all of these podcasts always come after talking to patients. You guys are the motivation for what makes me want to talk about this and want to explain things and want to kind of talk about what I've seen from other patients who have been on this thyroid journey. But the latest thing that I wanted to talk about came from a patient who had Graves' disease. And I know this is something that I keep coming back to. Partly I come back to it over and over because of what my patients say, but also it's because of how this is personal to me. I've told you before that people in my family are affected by Graves' disease and the long-term complications of Graves' disease that wasn't completely treated. And it really affects the rest of your life, and it can cause problems that greatly affect your health. And so we're going to talk about Graves' disease, but this applies to all things with regards to autoimmune thyroiditis. So just because we're talking about Graves' disease doesn't mean that this doesn't apply to Hashimoto's thyroiditis, which is kind of the twin brother, twin sister of Graves' disease, but looks a little bit different, but kind of the same cause. The fact that they're both based on your immune system attacking your thyroid and causing different problems. Today's episode is going to be focused on finding a miracle cure for thyroid autoimmune disease. And so we're going to go through all of the different treatment options that are available currently, but then we're going to dig into some of the new research. What are the new drugs that are out there? And finally, we will wrap up and we'll say, okay, of all of these things, what is the miracle cure, quote unquote? Which one is going to get rid of your antibodies, prevent you from having thyroid eye disease, help you feel the best, and make you live the longest? And we'll come back to that kind of at the end after we go through what's the traditional therapy and what is in the pipeline right now for coming forward. So before we start, I always have to go through and talk about who I am. So I'm John Russell. I trained originally at the Cleveland Clinic in Cleveland as a head and neck surgeon, decided that I wanted to specialize in thyroid and parathyroid disease, did extra training at Johns Hopkins, and then stayed there for almost a decade as the leader of the multidisciplinary thyroid tumor clinic. And so what that meant was all of the patients who had thyroid cancer or significant thyroid disease who had a problem that needed to be managed, we would all put our heads together, the medical doctors, the surgical doctors, radiation oncology, all of us would put our heads together to make sure that each patient got the best therapy and did the best possible. So I did that for a decade. And then in 2024, I left and started the Russell Center for Endocrine Health just outside of DC. And that's what I'm doing now. So gives me a little bit of time to do things like a podcast episode where I talk about thyroid autoimmune disease and miracle cures. And that's what we're here for today. So first of all, people always talk about the thyroid, and there's this big push online to make sure that people understand that thyroid diseases that are autoimmune are actually immune problems rather than thyroid problems. And that is, it's true. And sometimes patients feel frustrated that when they go to a doctor, the doctor only wants to talk to them about their thyroid. And patients say, well, if this is an immune problem, why don't you focus on my immune disease and how to make that better? And the answer is because that's harder, first of all. And second of all, because it's not as definitely going to work as when we focus on your thyroid. What do I mean by that? I mean, if we focus on your thyroid, whether that's by slowing your thyroid down or killing your thyroid or removing your thyroid, we know that we can prevent the long-term damage that comes from these autoimmune diseases. If we focus on the autoimmune disease, we don't have that same guarantee because autoimmune diseases they have lots of things that go into them, and it's not always set in stone that you're going to get a one-to-one improvement, meaning if I put you on anti-thyroid drugs, I know I can slow down your thyroid, and that will prevent long-term and short-term complications, osteoporosis, heart disease, etc. I know I'm going to actually make you better if I do that. Whereas if I try and treat your immune system with diet, with exercise, with supplements, with all of the rest of those things, it might work for some patients, but it's not going to work for everybody. And in fact, what you do is actually going to be very hard to reproduce from patient to patient. And so when patients are looking for an immunological cure, something that really gets to the quote unquote root cause of what's causing their problem, patients have to understand the reason that doctors don't apply those to everybody is because they just kind of don't work for everybody. And it's kind of a minority of patients that they work for. The problem with that is that when you go online, you see these huge groups of people that say, hey, this worked for me. And guess what? That's because Graves' disease is a pretty common problem. It's actually attracting more and more investment. We'll get to that later because of how common it is. And that's creating opportunities for people to go in and create new drugs, which is good for all of us because that's going to make it easier for us to treat these autoimmune conditions. And if you expand Graves' disease, which is pretty common, to include Hashimoto's as another end of that immunological spectrum, then you can say, wow, there's like up to 20% of Americans that have a thyroid problem that needs some sort of treatment. That's a huge market. That's a big demand for people to come in and do it. And so when there are patients who either eliminate gluten or maybe they start taking selenium or something like that, so many millions of patients are doing those things. So many patients are doing those things that of course some of them are going to have good results. And that's just because if you have 1 million people taking selenium or 1 million people stopping gluten, some of those are going to have good results. And then if those people go online and say, I stopped gluten and it worked for me, you have some anecdotal experience or anecdotal evidence that stopping gluten is a good thing to do for Graves' disease. But that's different with what you do as a scientist, because as a scientist, we would take 100 people that have Graves' disease or thyroid disease of some autoimmune type, and we would put them on a gluten eliminating diet, and then we would see who actually gets better by doing that. And what we would find if we were to do that study, which studies like that have been done before, is that it doesn't make a significant impact for most patients, and it's pretty hard to do. And so that's why as scientists, as doctors, even though there are some things that work for some people, we don't routinely recommend them to everybody if they don't work better than a placebo. And I do need to stress that placebos actually work pretty well at fixing especially immune type conditions. And so if you're taking something that is prescribed, some sort of root or supplement or something like that, there's a chance that it will work. And there's a chance that a placebo would work. And so it's really frustrating for patients when they hear their doctor say that something doesn't work. Well, what we mean when we say it doesn't work is that we mean that it doesn't work for most patients any better than a supplement. It doesn't work for most patients any better than a placebo would work. And so that's hard because patients kind of, they have their own experience. And if something works for you, fantastic. That's great. And if it worked for your friend, great for your friend. But be very cautious if you're online and somebody's trying to get you to buy a supplement or buy some sort of product to make things better. That's when you should be especially skeptical, because some of these things are going to work for some patients just because even placebo would work for some patients. But that's different than when you go to see your doctor can't give you a sugar pill. They can't give you a placebo. That's unethical. And so because it's unethical, we can't use that. And that's hard, especially with these immune conditions, which will wax and wane and get better and worse over time. So sorry for that tangent, but we had to kind of hit on that. So as we talk about immune problems, patients are always worried about that. We know that Hashimoto's and Graves' disease are a couple of immune problems that are very common, affect up to 20% of Americans. But what's the miracle cure then? If I'm telling you that elimination diets and intermittent fasting and, ashwagandha or who knows, whatever else you might be taking, if there's not scientific proof that it works for most patients, and so the efficacy that it has for you is essentially the same as if you were taking a placebo, then what are the treatments that are available and why should you be doing them? Well, first of all, if you have something that works for you and gets your thyroid levels back into the normal range, then stay on it. And unless it's something that's unhealthy, and you need to be working with your doctor on this one, unless it's something that's unhealthy, then good. That's fantastic. I'm glad that you found something that's working for you. Just be cautious as you advise that other people do it, because not everything works for the same patients. It's not one size fits all. So what are the things that are proven to make people live longer? Essentially, there are 3, and I'm going to broadly classify them as anti-thyroid drugs, radioactive iodine, and surgery. And don't worry, we will come back around later to talk about the new therapies and kind of the miracle cure, quote unquote, that could be the best choice for most people with thyroid disease, thyroid autoimmune disease. So first of all, anti-thyroid drugs. We've talked about these a little bit before, methimazole and propylthiouracil. These drugs work by decreasing your body's ability to make the active form of thyroid hormone, which then goes on to hurt your body. You have to have some thyroid hormone in your body in order to stay alive and to function, but these prevent your body from making too much of it. And that's why you have to kind of adjust the dose. The good about these drugs is that these drugs are pretty easy to take. You can adjust them and go up and down with them as needed. And for some patients, if not all, after a period of time on these drugs, their bodies will kind of go back to normal. The immune system problem will go away and they'll go totally back to normal. Now, we don't use these anti-thyroid drugs for people with Hashimoto's. We just use them for people with Graves' disease, because if you have Hashimoto's thyroiditis, you have an underactive thyroid. And in that situation, we actually need to boost your thyroid hormone. Now, we might give you thyroid hormone to get your thyroid hormone levels back to the normal range. But again, that's not like a root cause fix, which everybody's always worried about. That's more of like the Band-Aid. It's your thyroid hormones aren't good enough. And so we want to make them the right level. And so that's what we would do if you have Hashimoto's thyroiditis and you're not quite back to normal with your hormone levels and you're not feeling great. Now, with these drugs, even with thyroid hormone, it's hard to get you in the perfect right level. Your thyroid, when it's functioning appropriately, does that naturally. And that's the best case scenario. So all of these treatments are not the best case scenario. Best case scenario would be your thyroid works normally. It makes enough hormone, but not too much. You have to realize that when your thyroid goes off, it does affect the quality of life of patients. Whether your thyroid is overactive or underactive, it's going to make you feel worse. And so our goal is partly to get your thyroid levels back into the normal range, but also partly to get your antibodies back to disappear. Because if your body has to make these antibodies, then they will be going throughout your entire body, affecting other organ systems such as your eyes. They can cause fatigue. Your body feels like it's constantly having to attack something, which unfortunately is your thyroid, which only makes you feel worse over the long term. So these drugs are great. The biggest downside for most patients who are in childbearing age is that they can cause birth defects. And so we would switch you off of methimazole onto propylthiouracil if you have an overactive thyroid and you're thinking about getting pregnant. But even propylthiouracil, or PTU, is associated with birth defects. And so with either of those, it's not a perfect situation. We also know that with these drugs, there's a fairly high relapse rate. Plus or minus 50% of patients after a trial will relapse and their Graves' disease or their overactive thyroid will come back. And again, these drugs don't work for an underactive thyroid. We wouldn't want to put you on that because we actually need more thyroid hormone, not less. So anti-thyroid drugs are great, but they're certainly not a miracle cure for people with Graves' disease. So that's the first one. What else? Well, when we talk about other miracle cures, you could think about radioactive iodine, because this one's really easy. You take a pill one time, you don't share utensils or a toilet with your family for a couple of days, and voila, your thyroid is not overactive. You might be in the appropriate range, and after that, you might not need any more treatment. The downside with this one is that there is pretty good research that 6 to 10 years after surgery, your quality of life is going to be worse than if you had had another treatment option. And that probably has something to do, again, with your immune system, because with your immune system, the antibodies are going to keep going with if you have radioactive iodine, more than any of the other treatment options. And so in other words, that is the one that is the most, quote unquote, Band-Aid like of all of them, because your antibodies will still be high for the long run. Yes, you might get your thyroid levels back into the normal range. Yes, it's pretty easy, but there's a fairly high rate of patients needing to go on thyroid hormone therapy afterwards because we killed too much with radioactive iodine. There's also a small but not zero risk of causing another type of cancer in the future. Finally, this doesn't really fix the problem if you have a big or visible thyroid or you have thyroid symptoms. And so just like with the anti-thyroid drugs, radioactive iodine is not going to fix any of that. And perhaps most significantly, if you have radioactive iodine, it is the most associated with causing problems with your eyes. And if you have thyroid eye disease, or you know somebody with thyroid eye disease, this can be a big deal, significantly affect your quality of life. You've got the red eyes, the bulging eyes, very problematic for those patients who have to deal with it. But don't worry, I'm going to come back to what some of the therapies are for thyroid eye disease as we go a little bit further on, because there are some cool therapies that are already exist, and there's other new ones that are coming on. So we'll talk about that a little bit later. So I would argue that radioactive iodine is not a miracle cure. And then the last one of the traditional therapies is surgery. And we'll talk about surgery a little bit as we kind of go along. Everybody knows I am a thyroid surgeon. And so I have to couch everything that I say with the fact that as a surgeon, I clearly am biased, that I think surgery is a really good choice for a lot of patients. There are pros and cons that go into surgery, however. Surgery, there are risks that are associated with surgery. Um, Surgery can be associated with permanent voice changes. Your thyroid is gone for the rest of your life, and so you have to take thyroid hormone. And then the worst complication of all is the potential for low calcium, which can very much affect your quality of life and probably leave you not feeling better. Now, even with all of these, surgery for Graves' disease is the one that will make you live the longest out of all of the different therapies that are available. And we'll circle back around when we're talking about miracle cures about kind of some of the other pros and cons with each of these and which one could definitely be called a miracle cure. But I always have to put a plug in. If you have Graves' disease, almost always you could have surgery without a visible scar, because most patients are eligible for scarless thyroid surgery if they have Graves' disease or Hashimoto's thyroiditis. Now, surgery for Hashimoto's thyroiditis is also associated with improvements in quality of life, whether that's due to compressive symptoms, whether that's due to antibodies. All of those different things do tend to get better for patients who have surgery for Hashimoto's thyroiditis as well. So compared to the other two therapies that we talked about, Graves and Hashimoto's can actually both be improved with thyroid surgery, whereas Hashimoto's doesn't get better with anti-thyroid drugs, nor with radioactive iodine. And those are both instead designed more for Graves' disease. Okay. So those are kind of the standard therapies. What are the new therapies that we're talking about right now? Well, the first thing to know is that they have found in a very small trial, they found that adding methotrexate, which is actually not a new drug at all. It's an old chemotherapy drug that has been used for lupus and some types of cancer for a really long time. But adding a low dose of methotrexate to your anti-thyroid drugs such as methimazole seems to improve the cure rates or the remission rates of Graves' disease. And so that's kind of an exciting thing. But I always do mention to patients, hey, if you're really worried about, your immune system and all the rest of that, then you have to think this is a chemotherapy drug. And so I'm excited about it. I think the risks are pretty low, and I think it could be a good option for a lot of patients. But patients have to understand with each one of these things that it's not a terribly natural therapy with any of these. And patients are very excited about natural therapies for Graves' disease and for Hashimoto's thyroiditis. And we have to understand what is natural, what is not natural. And really, our goal is to get you cured as easily and safely as possible so that you go back to feeling well. That's what we actually care about. Okay, continuing on. So talk to your doctor if you're on anti-thyroid drugs, if there's a role for methotrexate to be added in, and if that might give you a better chance of being cured. Now, again, with anti-thyroid drugs, radioactive iodine, we don't usually use these if you have a big visible thyroid or if you have thyroid eye disease. It can also make these problems worse. And so you need to be talking to your doctor quite a bit. And certainly if you're smoking or close to secondhand smoke, you're going to want to stay away from that because that will definitely exacerbate your thyroid eye disease. So be cautious with that. Okay, continuing on. There's a new drug that is highly effective for people with thyroid eye disease. This is the one that everybody knows about already. It's Tepra, which can be used. It's an injection, and it gets some pretty fantastic results with thyroid eye disease. It's an infusion that happens. You can do it up to a few times, and it's pretty effective at improving symptoms of thyroid eye disease. There's another surgery that's older. So for people with very severe, like diplopia, which is double vision, or significant proptosis, where your eyes are kind of bulging out, you could consider orbital surgery, where you go in through your sinuses and you actually open up space to decompress some of the fat that we all have around our eyes so that doesn't allow your eyes to bulge so much. And that can be a good therapy for helping people with severe thyroid eye disease. It's not for everybody, but it can make your eyes look a little bit more natural, and it can also help your vision. Okay, so we set the stage already. We've gone through all of the other things. Now let's talk about what the new drugs are that are in the pipeline, and then we'll wrap up to what our miracle cure actually is, quote unquote miracle cure. Okay, so when you think about this, the new drugs that are kind of in the pipeline, so there's one called batoclimab. and it's twin brother, twin sister, IMVT 1402. Both of these drugs work by giving your body, and these are essentially antibodies, so they're monoclonal antibodies that are given to you, and these antibodies bind the existing anti-thyroid antibodies that your body makes when it has Graves' disease. And they go in and they attack these antibodies so that they get absorbed and reprocessed faster so that they can't be used to attack your thyroid. And they seem to be pretty effective. So what you would do is you would take these drugs, these are injections, and you would inject these drugs, and it would keep your body from making too much anti-thyroid. So that thyroid receptor antibody that is checked, or thyroid stimulating immunoglobulin, these different things that are directly against your thyroid that we know because we test labs for them. These drugs would target those so that they can't target your thyroid. And so hopefully, ideally, over time, with your thyroid not being able to be attacked, eventually your immune system would just give up. That's kind of the goal with these different therapies. So you would just keep using the injection, and hopefully over time, your immune system would give up. We don't know how long people would have to be on them. We don't know how effective they're going to be, but it seems like they're pretty promising at keeping most people from having progression or symptoms from their Graves' disease. So they can be a pretty effective option for some patients, and they're pretty exciting. There are other ones that are kind of coming down that same pipeline. Again, we're hoping that these can be self-administered subcutaneous injections, similar to like a Ozempic or something like that you would just give yourself an injection every certain amount of time. And hopefully that would fight your body's immune system as it tries to fight your thyroid. There are lots of drugs in the pipeline right now for thyroid eye disease. Some of those attack the insulin-like growth factor 1R. And these are antagonists. There's others that are proven. Those are so far in phase 2 studies seem to be effective at reducing proptosis, which is the bulging eyes, and also the double vision, which is fantastic. It works by helping your body not to be able to make as much, or rather to get rid of the extra anti-thyroid antibodies so that it doesn't make your thyroid eye disease worse. And so that one seems to be effective for a lot of people. And then there's another one, the last one that I'm going to talk about, called satralizumab, which is an anti-IL-6, which is an immune signaling protein. And it seems to make thyroid eye disease better as well. So lots of things in the pipeline for people with thyroid eye disease. And it's pretty exciting because each of these drugs works on a different part of the immune system, which is the actual root cause of what's causing your thyroid problem. Okay, now I promised you that we would talk about what the miracle cure is for thyroid disease. So when I say that, what would a miracle cure look like? Well, it would be the one that makes you live longer. It would be the one that almost never has a recurrence. It would fix any visible goiter. It would cause less heart problems. It would cause less thyroid eye disease. And it would ultimately make your antibodies go away, which again is the root cause. And ideally, it would do it as quickly and definitively as possible. And that's the miracle cure. And guess what? There's only one of the things that we've talked about that actually does that, and that's surgery. For patients who have thyroid surgery, it is the only one that will actually make your antibodies go away in almost everybody. Sometimes patients with anti-thyroid drugs, the antibodies will eventually go away after years and years. But with thyroid surgery, most patients, the antibodies will go away, meaning that your immune system without a thyroid to attack will kind of realize there's nothing more for me to do, and it will stop attacking your thyroid and stop making those antibodies. That's probably why patients who have surgery have a much better quality of life than patients who have radioactive iodine years and years later. We also know that surgery is the only one that's going to make you live longer when compared to anti-thyroid drugs or radioactive iodine. And we think that's because your thyroid levels normalize the faster. And that's the key thing with all of these therapies. We want to keep your thyroid hormone levels in that normal range because that's where you're going to live the longest and have the best outcome. You're not going to have as many heart problems if you have thyroid surgery, especially for Graves' disease. Almost never will your thyroid Graves' disease come back if you have surgery. It's just the definitive cure for it. It's also the only one that's going to consistently fix a visible goiter. Again, you can do this without a scar, so you don't have to do that. You're less likely to have heart problems. Compared to radioactive iodine, you're 74% less likely to have thyroid eye disease if you have thyroid surgery. And again, most importantly, your antibodies eventually go away. So why don't more patients have surgery? If surgery is the miracle cure, oh, by the way, it also works for Hashimoto's thyroiditis because again, the same thing, those antibodies go away over time once your thyroid's gone. And it will help those symptoms of compression that a lot of people have where they have a hard time swallowing and things like that. So why don't people have surgery more often for autoimmune thyroid disease, whether that's Graves' disease or Hashimoto's thyroiditis? And the answer is because most patients don't start by seeing a surgeon. Most patients start by seeing an endocrinologist. And when you see an endocrinologist, endocrinologists don't do surgery. Endocrinologists choose to go into medicine and treat the body with medicine because they think that's the best approach. And surgeons, of course, we go into surgery because we think that's the best approach. We like to do things a little bit differently, but we all have biases for or against the fields that we choose. And so it's our job to kind of focus on the research within our field so that we can help each of our patients the best way. But if you have a thyroid autoimmune condition, talk to your endocrinologist or your primary care doctor and say, hey, is it worth me talking to a surgeon so that I can discuss some of these different things? And the fact is that, again, surgery is the only one that's going to make the antibodies go away almost all the time. It's going to be the only one that almost never comes back after you have surgery. So again, why don't more people have it? Well, because they see an endocrinologist and not a surgeon most of the time. And also because there are risks that are associated with surgery. We talked about some of these before. We talked about the worst risk, which is the risk of low calcium, the low risk of changing your voice. And then there's also, you have to normalize your thyroid hormone levels afterwards. A lot of times for patients who have been suffering for a long time with thyroid disease, whether that's Hashimoto's or Graves', we will see that they're very frustrated because they haven't been able to regulate their thyroid hormone levels anyways. They're very tired, they're having weight fluctuation, they're losing hair. And so all of these things are so problematic before they come to see us as surgeons that they're already very frustrated with the situation. After surgery, they can become frustrated because a certain percentage of patients won't make or won't convert inactive thyroid hormone into active thyroid hormone. And as doctors, we need to do a better job of making sure all of our patients are on the right type of hormone for them, whether that's the traditional Synthroid or levothyroxine, or which works for most people without symptoms. Despite what you might read online, the vast majority of patients do really well with just the traditional levothyroxine. But also there's things such as natural desiccated thyroid hormone, or NDTs, such as Armour or NP thyroid, which can be very effective for some patients who need a little bit of T3 but want it to be taken simply. And then there's other patients who need a dose of that little pick-me-up active thyroid hormone, and you might even take it a couple of times a day. And if you find the right doctor who will really work with you, or the right provider, I should say, because sometimes there are people who are doing a really good job with this that aren't actually physicians, but are other medical providers who are highly trained and work with thyroid patients every day and have really good outcomes. And when you work with one of these people, you can almost always recover your normal quality of life and get back to where you were. And so if you can get back to that excellent quality of life and cure your antibodies and avoid thyroid eye disease and make yourself live longer, I would say that's kind of the miracle cure that we're all shooting for. Our job is to set the table and say, these are the pros and cons of the different therapies as they exist right now. But when I have a patient who comes in, especially a patient who's of childbearing age or thinking that they might want to have kids in the future and they have Graves' disease, for me, there is one thing that will fix the antibodies, definitively fix the problem, leave them feeling better over the long term, avoid thyroid eye disease, and also prevent their thyroid from getting so big that they have to stare at it and they have all the symptoms that come from having a goiter. And that's actually surgery. And so when I talk to patients, I think you have to talk about surgery as one of the options, and you have to have a long-term treatment plan so that each patient can get the meds that they need after surgery so that they feel just as good as they can. And that's where it's really important to have a good relationship with your provider. This is mostly focused on Graves', but it also applies to Hashimoto's thyroiditis. There's pretty good research that especially if your antibodies are high, if you have thyroid surgery for Hashimoto's thyroiditis, most patients will feel better afterwards. So the surgery is different because it's not just for Graves' disease. It can help people with Hashi as well. So there you go. Is there a miracle cure? Well, frankly, I don't know that anything's a miracle cure. There's certainly some patients who have miraculous results from any of these things, and there's patients who have miraculous results just from miraculous healings. Those things happen, and they happen on a few patients every once in a while, and it's fantastic. Sadly, we can't really rely on those, and so we try and take a more science-based approach for what is going to work for the most patients the most often with the fewest long-term side effects. And then we do research to try and see how their quality of life is after treatment. And then we try and optimize that as well. And it seems like when you boil all of those things down, surgery seems to have the most long-term benefit for the most patients. If you're healthy enough to have surgery, and if you find a surgeon who does lots of thyroid surgery and has good outcomes. But you have to make sure and do all of those things, or else you're not going to have the best results. So there you go. That's it in a nutshell. If I can help anybody, if you have questions, comments, please send them to me either through this podcast. If you liked this, please share it with somebody who has an autoimmune thyroid condition. Again, none of these decisions should be made in isolation. You need to talk to your doctor. If you want a second opinion, I love second opinions for all things thyroid disease related. Advocate for yourself. Try and get in front of somebody who's going to listen to you, and hang in there. This is a really tough condition, and it's a chronic problem that is kind of undertreated, undermanaged, underrespected in American healthcare. Hang in there, advocate for yourself. You've got this. Thanks for listening.